A very good evening and welcome to the India Development Debate. I'm Tamanna Inamdar and I'm glad to be speaking with you this Friday evening. So what do we have lined up for you? Let's take you through what we have on the show. First up, well, it's a big day for India. We have officially crossed 1 million cases. What does it mean? We need to break down the data because there are so many differing versions and different ways of reading this data, and that's what we're going to talk about first on the show. It's also a very interesting story that we're going to be discussing in detail. Multiplexes have sent a list of guidelines they'd like to follow in a bid and a hope that the government allows them to open up. But is it really safe? What are those guidelines and what is the future of cinema viewing going to be looking like? I have a very special guest. I'm going to be speaking with Kamal Gyanchandani. He is the CEO of PVR and also the director at the Multiplex Association of India. We're also going to get you a slice of a very exclusive conversation we've had at ET Now with the leadership team of Zoom, where they say that they're an American company. My colleague Chandra has done that interview and we'll play it out later in the show as well. But let's get first to the big story. And the big story really remains COVID-19 and how it's progressing in India. So we've crossed the 1 million mark. That's 10 lakh cases. The number sounds huge. The number sounds scary, but there is a lot of detail hidden in that number as well. So the health ministry says that the active cases out of that 10 lakh is 3.42 lakh cases, which means 10 lakh is the total number of people who've had coronavirus or tested COVID-19 so far, COVID-19 positive so far. It includes those who have, passed away, and it includes a large number of people who've recovered as well, and those people who are suffering from the disease right now. So that's the 10 lakh number. Then we go into other kind of details. What is the recovery rate? What is the mortality rate? And depending on who you speak to, these numbers paint different pictures. What we're going to try and do on the show today is understand what the true picture is. So I want to welcome my guests this evening. I have Dr. Hemant Thacker with me. I have Dr. Arvinder Soin with me on the show, and I'm also speaking to Dhrubabrata from Protiviti. Great to have all of you on and speak about this very important subject. Dr. Soin, let me begin by getting your take on the 1 million mark. Now, some say that this is very worrisome. Is India poised to even beat Brazil? We're already the third largest in terms of numbers of cases, and the curve doesn't seem like it's flattening. The other take is that, hey, don't look at the 1 million number. Look at the mortality rates and the recovery rates. And if you look at that per million, we're not doing too badly for a population our size. How would you break down the data?
Tamanna, I agree that 1 million is a scary sounding number, and it's a landmark we really didn't want to reach. But actually, the fact is that I don't think there are 1 million cases. There are probably 20 to 50 times the number of cases in India. So we probably, considering our population, we are probably ahead. We are at number one in terms of the number of cases. So I don't think we should actually be looking at cases. And I agree with the second viewpoint which you gave, which is that the encouraging part is that the mortality of COVID infection in India and in general is now lower than what it used to be 3 months ago. So if you look at 26,000 deaths in 1 million cases, you're looking at approximately 2.5%, right? So also, I think that we've learned to treat COVID better. So people who are hospitalized, who have moderate and severe disease, we're able to manage those patients better. So the mortality is coming down. And I also believe, and I don't really have strong scientific data to prove that, but I'm a practicing clinician and I work in a hospital where we have 150 COVID patients being managed by our ICU and infectious diseases team. I feel that the virulence of the virus is also coming down. So those are the silver linings in the otherwise worrisome figure of 1 million or perhaps much more.
Yeah. I think we of course need to look beyond just the numbers at how we are handling it. It is a landmark which requires us to understand what happens next. Are we looking at this going on increasing till the end of the year, till early next year? I mean, there's an MIT study which says that by next year, India is going to be worst hit. Before I come to Dr. Thacker, I want to go to the numbers, man. Dhruba, how do you look at the 1 million mark? And I know that at Protiviti and at Times Fact, we look at the active cases, just like the health ministry is pointing out, that it's actually 3.42. But I understand that in your worst case scenario, this could also go up as high as 6.5 lakhs.
Right. So what we are looking at is, we are looking at the numbers change closely, right? When we started the exercise, we were on a lockdown, so it had its impact. So on the unlocking, we see that the cases are rising and rising rapidly. Now, the reason, if you see it's rising, it's not that Mumbai or Delhi is doing badly. It's a number of states and cities have started to kind of increase in the numbers. So yes, we are looking at the numbers closely. We are seeing that the spike is much higher than it was initially. And it's because the epicenter is changing and there are multiple points where these numbers are rising and rising very fast. The only concern I would say in this entire thing is, if it rises too fast, it puts a kind of a stress on the healthcare system. Otherwise, as the guest is talking about, yes, our mortality is on the lower side, our recovery is on the higher side. So we are able to keep a bay on what the active number of cases are. So that's a good sign. And if we can keep a control on the rise, we would see our recovery grow up even more, right? At 65%, around 63% where we are, I think as the time progresses, our recovery rates will also increase.
On recovery rates, Dr. Hemant Thacker, I want to come to you on this. And of course, your view on the 1 million figure. On recovery rates, some of the experts I've spoken to, and I've had an opportunity to speak to many, say that a 60-70% recovery rate is not something to really be celebrated, because anyway, generally, it's hoped and expected that 90% of people who get COVID recover. How do you look at the conflicting sort of breakdown of the numbers that we're saying?
I think I agree with you and the experts who said that, because out of 100 COVID patients, 85 to 90 are going to recover asymptomatically without any help. They don't need anything to be done for them. It's the remaining, and that's where I agree with Dr. Soin, that we are now anticipating complications. We now are thinking on our feet. We know how to use this new array of drugs that we have. We don't give every patient Dexona and Remdesivir and Favipiravir and Tocilizumab. We know which one needs what. So since we do that, patients are now getting more confident. They're being treated at home with more confidence, and they know when to come to hospital. So we are interjecting their progress with the correct kind of medication. So our mortality rates are coming down. We are handling these patients better. Now, I don't think that the recovery rate has to be seen to be celebrated. It is the reduction in mortality rate that needs to be celebrated. And as you test more, in a lockdown, you had rationed testing. The stringent norms that you had for testing people were like a ration card or like a customs immigration form. Now that people are allowed to test as much as they like, you're going to go up in numbers. And I agree with Dr. Soin that 1 million is only the tip of the iceberg. You have 80% of the iceberg below the water. So a lot of more positive people are there. But the fact that they are there and they haven't come to hospital and they haven't have become symptomatic is something which we need to celebrate about. And this virus, we have to combat from the point of view of mortality rate alone, and not the numbers of how many there are. They're going to increase. Whether we cross Brazil or USA doesn't hurt me. We have a population that has overcome and overtaken Brazil and US. So that's going to be positive. We live cheek by jowl. We travel shoulder to shoulder. So all this is going to increase our numbers. I don't think we need to worry about those kind of numbers. We really need to worry about saving them, mortality rates, less hospitalizations, and less stress on healthcare.
So that's the important part now, and I think that's the part we should come to, which is testing. Are we still testing enough? And you are right, Dr. Thacker, when you say that testing has now been freed up. It's not rationed like before, but it is still prohibitive in cost in a lot of places. It's not still easily accessible all over. So when Dr. Soin says that the real numbers could be much larger, is that a function of less testing than we should be? If you look at the per million parameter, India still ranks pretty low.
So I'll give you an example. I have families where one person tests positive. He isolates himself. They have a 2-bedroom house and there are 4 of them in the house, and he isolates himself. And 3 or 4 days later, while they're being treated at home, the relatives come and call and say, "Sir, should we get ourselves tested?" And now our verdict is, if you are not symptomatic, don't bother to test. You have to look whether you developed antibodies, and you can look at that after 14, 15 days. So the cost of testing, which is apparently prohibitive, is non-existent if you know when to test. See, you cannot expect that a new virus with a new test, the cost comes down to pav vada levels. You're looking at a new virus, a new test, so it's going to have some cost. I'm not saying that you inflate the cost, but if you don't test, you don't need to take that cost. You must know when to test. You don't have to test out of curiosity. You don't have to test out of fear. You have to test if your symptoms and if you need to do something for prevention and passing it on. So if you consult your doctor, today the answer when people ask me, "Sir, I need a test." No, you don't need the test. "Sir, should we test all the others in the house?" No, you don't need to. And I've had wealthy families whom I tell them, you don't need to from the common sense point of view. So if you know when to test and how to use the tests, then your test becomes not so prohibitive and practically important.
Okay, I want to come to another very important aspect, Dr. Soin, and let me come to you on this, is how we have managed the lockdown and the impact of that on the cases. So India was one of the few countries who imposed a very stringent lockdown earlier on when we had relatively fewer cases, which were known. And then we opened up in the month of June when the cases were much higher. Because it just didn't make sense anymore. It was hurting the economy too much to remain locked down. A lot of migrant workers then left. They have gone to several places, and we've seen the cases just rise exponentially since then. Looking back, do you think there is merit in the argument that maybe we locked down too early and unlocked too early as well? That we sort of missed that kind of rhythm that the COVID-19 pandemic was causing?
You know, it's much easier to look back by hindsight and say we should have done this, we should have done that. But I actually feel that we did lock down in time, because if disaster had struck in the beginning and we had large numbers, India was certainly not ready, health facility-wise as well as psychologically, nobody was ready for it. So I think we did well in locking down early and putting travel restrictions early. Perhaps the lockdown needn't have been continuous for 3 months. It could have been maybe broken up into 2 lots, opened up and then shut down again as necessary. But, you know, the jury's out there, you know, it's all up in the air. There are different views. I think we locked down okay. But now, as you rightly said, we can't remain locked down. We must unlock, and we are unlocking. But what must be remembered for the next 6 to 12 months, until we have reliable drugs and or vaccines, we must be disciplined as a society, as a people. We must remain disciplined. We must mask ourselves. We test only vulnerable populations. I completely agree with Hemant. There is no need to test everybody who's been in touch with somebody who has COVID. If they are asymptomatic, just leave them alone. So test vulnerable populations, those in hospital, those who are elderly, those who have other diseases. Always remain masked. Do not have gatherings and congregations of more than 30, 40 people, and that too properly physically distanced. That really has to be remembered. I mean, if you open schools too early, then there could be a spread, although younger people don't get affected that much. But there could be transmitters of infection. There are, again, opposing views there. Israel opened their schools early, and then they had to shut down because they suddenly had a rise in cases. So I think as we unlock, we have to do social distancing, physical distancing at work and in society, test vulnerable populations, and keep ourselves masked and be disciplined as in the community, because we are all in it together. You can't just blame the government for not enforcing the right policy if we are not going to.
That's what we've been doing all this time. No, sure. My question is that we have been, all of this is what has been the prescription all of this time, Dr. Soin.
But this remains.
But it's not showing any impact.
So
the numbers are increasing. So what is your sense? Are we just going to have to wait for this to sort of die a natural death? Or can we do something more? We're now looking at a situation where we're technically unlocked, but there are mini lockdowns all across the country.
Yeah, I understand what you're asking. So I don't think anybody has a clear answer, but it is clear that masking is very important and physical distancing must remain. You mustn't get crowds together in any situation. Now, maybe the numbers person can tell us more, but if you think we're going to have as many as Spain and UK had, I mean, they had 6,000-7,000 cases per million, and they had close to 400 or 500 deaths per million. If we're going to have that, then you're looking at crores of people getting it and losing lakhs of lives. I don't know if we're going to go that way, but I think if we remain disciplined, that peak may not be so high per million population. But if you go by the example of UK and Spain, it looks very scary for us in the future.
Dhruba, what is the sort of data telling you? We're seeing different kind of data sets and predictions, looking at different numbers for India. What is the data telling you in terms of when this will peter out and the rate at which we are growing?
Okay, so the question you asked before, right? See, you are talking about an increase, maybe not lockdown, we would have seen a much higher number for sure. And after we unlocked, we are seeing there is a rise. And the rise we expect to continue as long as centers continue to spread. If you look at Bombay and Delhi, it has kind of tanked out. They are going downwards. Tamil Nadu is kind of also nearing its peak. But there are others. And if we can keep a check on the different epicenters, we are looking at maybe September, things getting back to normal. End of August, September, we are going back to normal overall India. But the problem which happens is there are new epicenters. So if you look at Bihar and West Bengal, the numbers are rising much faster than it was doing initially. So is now the epicenter moving from the south to the east? It's time that will tell, right? And the more we can keep a check on the numbers, or we can keep a check on how people are transmitting the disease, the better we will be in controlling that. And as you rightly said, unlocking has to happen with certain precautions, social distancing and all others. Otherwise, we are definitely looking at much more higher number than what we are anticipating. And coming back to what you asked, right, on the other piece, which is different people are predicting different numbers, because their assumptions also vary a lot. So if there is no intervention, the rate at which we are growing, we will kind of end up at what MIT is talking about. But I believe that there will be interventions, the mini lockdowns that we are talking about. If you look at Karnataka, if you look at Pune, there are lockdowns which is there. That's to get the number in check on those places. And I believe that will keep on happening. We will have smaller, but more effective lockdowns.
Can I also make another point about the hysteria about numbers, Tamanna?
So these lockdowns are... Yes, sure. Do comment.
So, I think the important thing, and Hemant did touch on that a little bit. The important thing is to care for the sick and whatever helps in that. So if you want to help the situation, then you obviously make sure that the COVID warriors or the frontline workers, the doctors and the nurses are compensated, they are comfortable, they are tested often as necessary because they have to take care of the patients. And similarly, you have to facilitate, providing facilities to COVID centers, COVID healthcare centers, private and public. So you have to care for the sick and you have to make sure things are smooth for hospitals and other centers caring for the sick, right? So that's the first part. Rather than worry about the numbers climbing because they will climb. Okay. Now, the other thing you have to help in is for science to establish the usefulness of drugs and vaccines. So if someone wants to help the situation, they must volunteer for a vaccine trial. We need thousands and thousands of volunteers for vaccines to be shown as effective or not, because you need 20, 30,000 people to get the vaccine, another 20,000 to get a placebo, and then you need to see their incidence of infection. They will get all these people. They all have to be volunteers. So, we have to think of the drugs and vaccines over the next 6 months if we really have to get back on track and to our original normal lives.
You've raised that very important question. Dr. Soin, since you've raised that very important question about vaccine and volunteers, a lot of people watching this may be wondering that why should we risk it? What are the side effects? There's not a lot of information out there or knowledge generally on what it means to volunteer for a vaccine trial or how it works. Usually, there are programs, people are recruited, maybe there's some payments made. So why would people volunteer? Can you explain to us how you envision this and what would be your response to someone who asks, is it safe?
So all studies for vaccines and for drugs are done in 3 phases. And before the 3 phases are undertaken in human beings, they are done on animals. So, the side effects and the doses have been approximately worked out in animals. Then they are subjected to phase 1 trials, which are the safety trials. Typically needs 20 to 50 people to be given that vaccine in different doses. And if it is safe on them, only then the vaccine goes on to phase 2 trial, which is to see that if it is injected in a person, it is having the desired effect of producing the antibody. And it's only after that you need a phase 3 trial, which is the thousands of patients that I talked about. So once you reach the phase 3 trial stage, which is happening to at least 4 vaccines across the world, then you are reasonably certain that the vaccine is safe because the safety studies have already been undertaken. Now, you have to participate in a trial because if you and I don't do it, then who will? Because if we have to save ourselves as a society, then we are the ones who have to volunteer. So we must volunteer. If we are healthy, then we must volunteer to be a part of the vaccine trials.
Okay. I want to come to another question of how this is spreading. And here's what I want to understand, Dr. Thacker, is so far the official word is that there is no community transmission in India. Today, the Kerala Chief Minister in a news conference said that there could be community transmission in some parts of the state. Now, if there is no community transmission, do we know where all of these cases are coming from? I want to understand what the efficacy of these lockdowns then are. Or are we to assume that people have in general just been very callous and careless and that's why, cases are just spreading and spreading? Because there are stories of people sitting at home, isolating, who have still managed to test positive.
I think the story of the term community transmission is similar to the story of numbers. It's only a term. The fact remains that the number of people getting infected. See, the word lockdown means economic restarting or resumption. It doesn't mean lockdown of all the preventive measures that you are taking. Unfortunately, when the lockdown has started unlocking, people are more worried that the shutters on the wine shop are closing and they make a beeline for it. People are more worried that the bus is leaving and they do not observe social distancing. And those very people whom you said have not stepped out of their house, they've had maids or servants come in from certain areas and they've contracted it from them. So if you try to wonder what came first, the egg or the hen, you're going to reach nowhere. It is, see, whether I call it community transmission or transmission in the society, in the buildings, in the locality, in the various zones or wards, it's the same thing. I agree with Dr. Soin that if you want to help the hospital and the healthcare workers, please maintain your civil obedience. People think that now that there is unlocking, they want to go for a drive, they want to go out, sometimes they don't don a mask, they conglomerate, from 4 they go to 8, 8 they go to 14. How much can the police do? How much can everybody do? And the hospitals also, remember, healthcare workers, whether they are doctors, sisters, ambulance drivers or policemen, have stopped for 3-4 months. If you don't look after them, if you don't look after the hospital, somebody is going to get tired, somebody is going to get fed up. And all of them, if they are disincentivized, what he talked about, if you don't look after them, you're going to have a breakdown of healthcare facilities. The onus is on both the recipient as well as the giver. The common man, the community has to understand that to prevent yourself, you don't have a vaccine, the second best thing is your mask, your distancing and your sanitization. And your sanity of not getting conglomerations and groups together. Doctors have to understand that the society will help them in reducing these cases. So that only
Dr. Thacker, if I can just come in. Sure.
Sure.
I just want to ask you about, a comment you made when we were talking about how people sitting at home are getting it, and you said, their maids or their servants are coming in. And I think it's an important point to pause on, because let's just remind viewers how this all started in India. It started with people who had traveled abroad and came in. So if you go to see, in a sense, it was a reverse transmission. The relatively rich giving it to the poor. But that's a different story. The question I want to come to you on, Dr. Thacker, is the kind of impact this is having on livelihoods. The fact is that a large part of this country needs to go out to work. They need to go out and do their job, which puts them in the way of risk every day. I mean, not all of us can, work from home, and medical workers are at the front line of that. So, which is why hats off to all of you. How do you then ensure that you're still safe, or do you just go about it with the knowledge that you are vulnerable because the numbers are increasing?
From the common man's point of view, I don't see why nobody has thought of having different shifts. If I was planning Nariman Point in Mumbai, I would have offices from 7 to 1 and 2 to 6 or 2 to 7. So they have less people, more people coming to office, but less at the same time. I would have staggering with odds and evens. So somebody has to start planning, because this is here for the next 6 months. As far as we doctors are concerned, we have to go. We work on every day is a Monday or every day is a Sunday. We work every day of the week. It is for the common man who needs to earn his money, who has to innovate, and the civic authorities have to help them to innovate. We had a problem getting nurses, mechanics, plumbers, technicians to the hospital. We hired private transport buses. We had to pay a lot of money. But in order to keep the hospital running, you need technicians, air-conditioned mechanics, oxygen repairers, everybody. So how did we do that? There were no public transport. There was nothing available. So we got private buses to bring them up from pickup points. So you have to keep thinking on your feet. I'm not saying we stay at home. I'm not saying we lock down. But you go about the lockdown in a progressive way. You can tell an office of 100 people that Monday to Friday, you work with so many people coming in the morning and so many in the evening. And next week, the other shift comes. Something has to be planned. Necessity is the mother of all invention. And if we don't do progressive planning, and if we throw caution to the winds, our numbers are going to go up. We can go the Spanish or Italian or US way. One has to be careful. One has to justify every move. Going to office is mandatory, but going out to dinner or meeting friends and patting them on the back and meeting in social gatherings is not mandatory. The year 2020 is to save lives. After that, it is saving livelihood. If you have a saved life, you will have livelihood. So this is something which I want to very strongly emphasize.
Absolutely. Absolutely. That's the perfect message actually to end this first discussion on. Thank you so much, Dr. Thacker, Dr. Soin and Dhrubo for joining us, because after this break, we come back to the lives versus livelihood question in a very different context. Multiplex Association has given a list of SOPs to the government in a hope that they will be allowed to open, because they feel that's what they need to save the industry. Is it safe to even start thinking about going to a movie hall to watch a movie? I'm going to be speaking with the PVR CEO after the break.